Welcome to Lexcura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lexcura Summit. Failure to rescue is the clinical and legal concept that nursing staff must recognize patient deterioration, communicate the change, and activate the appropriate emergency response before preventable harm occurs. It is one of the most important and often underused liability theories in hospital nursing cases. The modified early warning score, vital sign trends, nursing reassessments, provider notifications, and rapid response team records can reveal when deterioration became visible and whether the response was timely. In this episode, I will explain how to identify a potential failure to rescue case during screening and how to document the breach from early warning signs through delayed escalation and patient harm. Okay, so here's something to think about. In healthcare, there's this term, failure to rescue, that essentially means missing the chance to save a life when the warning signs were there all along. It's not just a medical issue, it's a human one.
That's such a powerful way to frame it. It's not just about the science or the systems, but about those critical moments where everything can change. What makes this concept so central to nursing?
Well, nurses are often the first to notice when something's wrong. They're the ones at the bedside observing patients, picking up on subtle changes that might signal a bigger problem. But here's the thing. Recognizing those signs is only half the battle. The other half is knowing what to do and having the ability to act quickly.
And that's where the idea of clinical triggers comes in, right? These are the red flags that signal something's off. A sudden drop in blood pressure, a change in mental status, or even something as subtle as a shift in skin color. Nurses are trained to spot these, but what happens next?
Exactly. Clinical triggers are like the alarm bells, but the response is what really matters. Nurses have what's called a response obligation, meaning they're expected to act on those triggers. That could mean anything from administering medication to calling for a rapid response team. But the reality is, there are so many factors that can get in the way. Staffing shortages, unclear protocols, or even just the sheer complexity of the situation.
It's such a delicate balance, isn't it? On one hand, you have these highly trained professionals who are experts at what they do. But on the other hand, they're working within systems that aren't always designed to support them. How do they navigate that?
That's the challenge. Nurses are constantly juggling multiple priorities, and they're often stretched thin. But they're also incredibly resourceful. They rely on their training, their instincts, and their ability to work as part of a team. And when the system works, when they have the support they need, it's amazing what they can accomplish.
So let's talk about what those systems look like when they're working well. What are the key elements that help nurses respond effectively to clinical triggers?
First and foremost, it's about having enough staff. If a nurse is responsible for too many patients, it's nearly impossible to give each one the attention they need. Beyond that, it's about having clear protocols in place, access to the right tools and technology, and a culture that encourages open communication. When all of those pieces come together, it creates an environment where nurses can do their best work.
And when those pieces aren't in place, that's when failure to rescue becomes a real risk. It's not just about individual mistakes, it's about systemic issues that make it harder for nurses to do their jobs. How do we address that?
It starts with recognizing that failure to rescue isn't just a nursing issue. It's a healthcare issue. It's about creating systems that prioritize patient safety and support the people on the front lines. That means investing in staffing, training, and resources, but it also means fostering a culture of accountability and collaboration.
It's such a complex issue, but at its core, it's about people, both the patients and the nurses who care for them. What can we do to better support nurses in these critical moments?
One of the most important things we can do is listen to them. Nurses are the ones who see the day-to-day realities of patient care, and they often have the best insights into what's working and what's not. By involving them in decision-making and giving them a voice in how systems are designed, we can create a healthcare environment that truly supports them.
That's such an important point. Nurses are the backbone of the healthcare system, and their ability to respond to clinical triggers can literally mean the difference between life and death. How do we make sure they have what they need to succeed?
It's about more than just resources. It's about respect. Respect for their expertise, their judgment, and their role in the healthcare team. When nurses feel valued and supported, they're able to provide the kind of care that patients deserve. And ultimately, that's what it's all about, making sure every patient gets the best possible care.
It's such a powerful reminder of the impact that nurses have, not just on individual patients, but on the entire healthcare system. What's the takeaway here for anyone listening?
The takeaway is that failure to rescue isn't inevitable. It's something we can prevent by supporting nurses, investing in healthcare systems, and fostering a culture of collaboration and accountability. It's about recognizing the critical role that nurses play and doing everything we can to help them succeed.
And it's about remembering that behind every statistic, there's a human story, a patient, a family, and a nurse who's doing everything they can to make a difference. Thank you for shedding light on this important issue.
Thank you for the conversation. Let's keep working toward a healthcare system that supports nurses and saves lives. Thank you for listening to Lexcura Clinical Insights. A failure to rescue case is built by identifying the point at which the patient's deterioration should have triggered recognition, communication, and intervention. The analysis should align the modified early warning score, vital signs, oxygen requirements, neurological findings, laboratory results, nursing assessments, provider notifications, rapid response team activation, transfers to higher levels of care, and the patient's eventual outcome. The key questions are when the change in condition became clinically apparent, whether nursing staff recognized it, whether the appropriate provider or emergency team was contacted, and whether delay allowed the patient's condition to worsen. When the record shows escalating warning signs without a corresponding escalation in care, the timeline may support a clear failure to rescue theory. That is how the clinical record establishes notice, breach, causation, and resulting harm. For more clinical intelligence, litigation analysis, and practical guidance, visit Lexcura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of Lexcura Clinical Insights.